As controversy swirls over the health care reform vote in Congress, some lawmakers are being threatened, including one of our own. 24-hour News 8 political reporter Jim Shella is here with more on that. Jim.
Deanna Barron-Hill is a Democrat, one of at least 10 members of Congress reporting threats as a result of his vote in favor of health care reform. Capitol Police and the FBI have been notified of threatening phone calls to Hill's office following the Sunday vote. Hill Press Secretary Katie Morrow won't talk about the nature of the threats or say how many threatening calls there have been. Meantime, Indiana Republican Mike Pence gave a speech on the subject today.
People who engage in such acts undermine our cause and should be prosecuted to the fullest extent of the law. But I also rise to condemn the efforts to smear millions of law-abiding Americans who oppose Obamacare by associating them and their principled opposition with these criminal acts. The American people have every right to oppose this government takeover of health care without being lumped in with bigots and vandals by liberals in Congress and in the mainstream press.
District offices of 4 congressmen in other states have been vandalized. Barron-Hill's spokeswoman tells me that Hill has been instructed by Capitol Police and the FBI to take the threats seriously. Jim Shella, 24-hour News 8.
Indiana Congressman Mike Pence is joining other lawmakers in condemning some of the actions by people opposed to health care reform. Democrats have reported threatening phone calls, bricks thrown into their offices, and even gas lines cut to their homes. Law enforcement, including the FBI, is investigating the threats. Leaders like Pence from both parties are denouncing those acts.
People who engage in such acts undermine our cause and should be prosecuted to the fullest extent of the law.
Some Democrats accuse Republicans of fanning flames of anger that could turn to violence. Republicans say their opposition to the health reform law in no way advocates such behavior.